Today we're going to go over a couple of different presentations related to the work of the President's Advisory Committee in Student Mental Health. The two areas that I'm hoping to cover today is a brief review of a 2012 Student Mental Health Review that was done at the University of Waterloo. I'm going to cover some of the background, the methods, results, and recommendations of that. And then I also want to speak to some work that was done by Drew Petico summarizing comments that came in as part of the petition that was distributed earlier this year. So let's start with the 2012 Student Mental Health Review. This activity, similar to the review that we're undergoing right now, was prompted by some growing concern across North America about mental health in higher education institutions. In fact, at the time when we're talking about 2010, a group of university presidents gathered and came forth with a position statement related to student mental health, and essentially saying that this is something that needed to be addressed very aggressively. And one of the ideas that came out of that, as well as some of the other reviews that were being done at the time, was a recognition that more individuals were entering university with significant mental health concerns, and it's actually due to the fact that we've gotten better with treatment of mental health, and so that individuals who previously might not have been able to think about going to university were coming into the university. And I believe that's true currently as well. Sadly, there was also a number of completed suicide that our university was concerned about at that time. We're talking about the time period about 2008, 2009, and while these events were taking place, survey data from across North America was showing an increase in suicidal ideation or number of students attempting suicide. So all of this, comes together to raise the level of concern about mental health in that period just prior to the 2012 review. We were also aware of report that was created by the Ontario College Health Association, which was drawing attention to some barriers for students related to how student services were organized. And so we wanted to pay some attention to that. I should say that this review was actually led by Chris Reed, who is currently Vice President, Associate Provost Students, University. At that time was the Housing Director, and he worked with a committee across the university. The group at that time chose a number of ways of collecting data. They created stakeholder focus groups, including service staff from Counseling Health and what was at that time called Office of Persons with Disability, and now we know it as the Accessibility Office. There was a specific focus group with the Undergraduate Operations Committee. A survey was created and distributed to a number of students. So at that time, our university wasn't using the National College Health Association survey, and the committee that organized this review created their own survey. There was a number of interviews done with partners in the community, leaders of other service providers. So I'm just going to get down and talk to a little bit about what each of these groups gave as themes for the review. In terms of the stakeholders, again, remembering that's counseling, health services, and accessibility, we're recognizing that there was some significant, what we called service delivery silos. So people working on the same problem, but working in isolation from each other. There was also recognition that, while we were providing intervention services, we were weaker in the area of prevention and early identification of mental health concerns. recognized by the service providers through these groups that students, as we've heard in our current times, were having difficulty accessing mental health services. There was recognizing that staff, the people who were involved with providing these services themselves were noticing there needed to be improvements in staff and caregiver well-being. So, how are we looking after our staff? There was recognition of some areas that needed to be looked at for developing staff, training staff, and then some recognition of gaps in service. We talk about gaps in service in this regard. We think about the continuum of service that are available for mental health problems. And at this time, there was a predominant focus on individual interventions with a little less emphasis on group or early intervention approaches. The students provided their input through the survey, and similar to what we're hearing in the current National College Health Assessment Survey, the top concerns is listed time management, getting enough sleep, a big concern about anxiety specifically related to academic success, and other life stressors, and those could be financial, those could be relationship stressors, were what the students were talking about in 2011 at the time the survey was done. Students were allowed to list what kind of services would be important for them to develop, and here's what was provided as themes. Students were looking for advice on managing stress, learning help to manage depressed moods, crisis support. Financial counseling was listed as a concern for a number of students. Students were recognizing that it's difficult to connect with other students, and we're reporting that it would be good to have the kinds of programs that would help with social connections. And then recognizing that services aren't always delivered in a user-friendly manner or in a way that takes into account students' unique culture and language. And then the students also commented on both the long wait lists at the time as well as perceived quality of the services. So in some cases, feeling that service quality needed to improve. Overall, then, the findings from these different avenues of data collection that were reported in the 2012 Student Mental Health Review was that there needed to be better working together of everybody who was involved with mental health and support services. So I would say that speaks to me of a organizational concern, that a sense that at times we're making it more difficult for students to know where to go for service, what kind of service provider for what kind of problem, and then having to, in some cases, duplicate by going first to health services, then to counseling, or vice versa. And we needed to do some improving in that area. Staff, and particularly students, making persuasive comments that there was a need for enhanced service and availability of best practices. In terms of enhanced services, there was no specific statement about, how many counselors, how many psychologists, how many social workers, how many psychiatrists. It was more a general statement about there needed to be more. And then also recognizing that services should attend to what is currently best practice in mental health services. So as you can imagine, there's many different ways that people enact mental health services, and the research does have some comment on what is the most appropriate approaches for individuals in this age category. And then finally, a big focus in this review, as I mentioned earlier, is the need for more prevention and early intervention regarding distress of students. This statement might speak to the fact that, while I said earlier, recognizing there need to be more access for service, but also that some good work could be done long before people feel like they needed to access a service like counseling or health. The recommendations, there was 47 of them, and I'm not going to list all 47 today. I'm going to give some highlights, at a higher level. Just to note, which I didn't mention, this full report is now listed, or is now available on the President's Advisory Committee website. And if you are interested, you can look at the detailed recommendations in the report. I would categorize the recommendations as some being organizational, some being more about services. The organizational recommendations were stated in several different ways, emphasizing the need for a single structure that included both counseling and health services. Looking at a leadership position that both organizations reported to as a way of ensuring smoother crosstalk and collaboration between those very important areas. There was a practical implication of this kind of a move was that more counseling staff should be moving into the health services building. And at the time, the health services building was being planned. In fact, some space was made available for mental health staff on the second floor of the health services building. And another major recommendation is the idea of creating a single leadership position related to wellness promotion and education. So the different times I've already mentioned that prevention and early intervention needed to be part of our strategy, and the group making this recommendation felt that it was important enough to increase the profile of the leadership in that area. In terms of services, recommending an enhancement of specifically psychiatric services, hiring a full-time psychiatrist, recommending a range of services, including an integrated intake. So integrated intake is an important feature of this change where it would be known if a person is seeking a service, it would be known by both health and counseling that that individual was looking for it, and ideally have essentially one door to come through when you're asking for a mental health service. A recommendation to increase the crisis response, and a recommendation specifically around substance abuse concerns. And then the service levels as these relate to wait lists and staff stress. So again, not giving a specific recommendation about how much additional services was needing, but drawing attention to the need for review of this area. The other area for health recommendations was health promotion, and that we needed to come up with a strategy. And this isn't, when we talk about health promotion, we're not just talking about posters and films and cards. I mean, that's part of it, but it's also taking a serious look at academic policies, other areas of stress that we may have some capability to adjust. I'd have to say this continues to be a conversation even in our current review. Some other specific recommendation areas, unique circumstances of international students, staff development and trainee development. The trainee part is we have a very active, and even at this time had a very active trainee program for psychology and social work students, as well as medical residents. And the recommendation was just to formalize this somewhat and take advantage of the opportunity of having a flow through of trainees interested in working with this population. Very important, integration of the electronic health record. It's a very significant piece required for the kind of collaboration that we're looking for. And then improving partnerships with external providers and with academic units. So that's, I think, probably covers key recommendations. So I want to speak a little bit to what have we done since then. I'm not going to go recommendation by recommendation, but a significant organizational change has been the development of the campus wellness department. We are using a number of different vehicles for emphasizing the importance of collaboration. We have common management teams where individuals from health and counseling are working together on building the organization. We have some other committees designed specifically for collaboration around mental health to, on a continuous basis, review where things have broken down in collaboration and make improvements. Important features I've mentioned in the last slide is the instituting of a common electronic health record, and this has been instituted for about 3 or 4 years, and where somebody registers only once to be on the health record, and then whether they go to health or counseling, their record is maintained, of course, with their consent to be part of the common record. The intake and triage has been significant development, particularly in the area of counseling, where there are 2 positions that have been added who specifically take information at intake, make decisions about the urgency of the need, and then pass the referral on to the counselor who's available for that. We use triage in the health center as well, particularly for days where there is walk-in happening and where we need to make decisions about the urgency of the individual's presentation for all health problems, including mental health problems. Service range of options. This has all been worked on over the last 3 or 4 years. We're seeing more group offerings, group therapy in the area for managing mood, for regulating emotion, number of different topics that come up. And then the coping skills workshops, which is a very important option for people who are waiting for service and have an opportunity to sit with some other students and a experienced counselor on describing what are some simple skills that they can learn to help themselves. Funding for psychiatric services was approved several years ago and has in fact resulted in additional psychiatric resources. In terms of counseling and other mental health staff, we've increased by about 7 positions since this review was done, and are continuing to review the need on a year-by-year basis in our partnership with the Student Services Advisory Committee. Recently, we've hired as that senior leadership position, the Associate Director, Health Promotion, and we see a lot of promise going forward on some health promotion initiatives related to mental health. I decided to kind of review these recommendations in a kind of a graphic way here. We did a review in April 2015, looking to see how far along we were with these 47 recommendations. We were pleased to see that about 34% of them we could report as completed, and another, I guess it's 9 or 10 were partially complete. So by that time we were at 55%. And in July of this year, in preparing for this report, actually, I looked at it again, and we've probably about 50% complete on recommendations and 87 partially or complete. There are some areas, granted, that have not been given the attention, and I do believe those will come up again in our current review. What comes to mind is still some work on health promotion and prevention. I think that we need to get a more focused effort on working with the needs of international students, and then we need to build up our capacity related to substance abuse, which is related to mental health. So, in summary about this report, I want to reiterate that this was a very significant move for the university, resulting in some changes, organizational, service delivery, perhaps even in how we think about some services. And it's been a very active document, I would say, and a live document throughout the time that it was done. themes continue to be relevant, and then we expect to see some of these recommendations to be reiterated in some form and perhaps even prioritized through our current review. But we think we're in a good place to do some additional changes. We think that some of the shall we call it the pain or the difficulty of making significant organizational changes are behind us, and that we can continue to look at service improvements based on our current review. I'm going to just move right along here and present a couple slides related to themes that have come to us informally. When I say us, I'm now speaking of the current President's Advisory Committee on Student Mental Health. I want to attribute here that the petition was the work that was done by a group of students in March and May in response to growing concern and as we know, a couple of tragic suicides in the spring of this year. And students were volunteering their comments, their suggestions as part of a large petition that was administered. In addition, once the President's Advisory was proposed, there was a number of spontaneous comments that came through to the President's office as well as to the website for the Advisory Committee. And so what Drew kindly took some time to do was to take these comments and organize them into some key themes, which I think are really relevant and actually happen to be areas that other universities, post-secondary institutions have also isolated as important. We were working from, I'll say Drew, I won't say we because he did this work, 296 different individual commenters, and we say 521 instances, meaning that sometimes a comment might have several parts to it, somebody giving advice or comment on more than one area. So what I'm going to present is all of the themes and then a bit of a rank ordering, I think, with the top 5 or 6 that have come through. And I encourage you to look at this. I'm not going to define the themes in detail, but certainly this information and the more detailed presentation that Drew provided can be available to various panel members. So what the 5 themes that we're seeing there was around service access and delivery, academic, inclusive and supportive campus culture, mental health awareness and communication, and campus systems and structure. If you draw your attention to the yellow bars, you'll have, I guess, the top 5 in terms of amount of comment that came. The first most common comment was around funding and resources of mental health services. About 19% of the comments were in that area. The second most common was around health promotion support, education, and programming. And almost 19% were commenting in that area as well. When we look at, as a third area, environmental factors, this spoke to what are things on campus that are conducive to positive mental health, even things like lighting in rooms, things like places where people sit, but I think more broadly also speaking about the social environment. Related to that, the next most common comment was a comment about the impact of curriculum, design, and pedagogy, and here commenters, and I should say it wasn't just students, there was staff, faculty, even some alumni that contributed comments, were reflecting on, are there aspects of the way we design our programs, our academic programs, that have inherent stress related to them. So hence we have our academic panel that is hopefully looking at that. And then our next area speaks to the quality of the experience, and this has to do with what people are experiencing when they come for service. And as we can see, that's 7% of the individuals commenting were commenting on the quality of the experience. And I can't say how many of those were negative or positive, but certainly people took opportunity to express both areas. So this is, I think, a good start in terms of capturing the views, the mood, and the opinion about student mental health, and was very spontaneous kind of comments. And it'll be important that we use some of our other processes to validate these areas, these themes. Is this what people are talking about in panels? Are these the themes that we end up finding about in some of our other information gathering exercises? We see these petition responses as being a very constructive contribution, and we thank the individuals who have taken the time to write, in many cases, very detailed and passionate statements about what they want to see happen on our campus. We put the themes out there for our panel groups, and as I mentioned earlier, they are the kinds of things that other post-secondary institutions are talking about and have built their mental health strategies around. That is all for today. I thank you very much for your attention, and I hope the information is helpful for anybody who's reviewing